This report today is really worrying, and it really highlights some of the big challenges that we're facing with the cancer workforce, which Macmillan has been sounding the alarm about for years. And we know at Macmillan that having good quality care, having access to a cancer nurse, adequate access to your doctors makes a huge difference for people and their cancer experience and helping people to recover from their diagnosis. And we've had massive challenges with workforce shortages even prior to the pandemic. That's all been amplified over the last 2 years. In our own research, we estimate that by 2030, we'll need an additional 4,000 nurses across the UK to provide the care that all of us will need. So this report really needs to serve as a wake-up call so that government are investing in the workforce that we need both now and in the future for people with cancer. So definitely COVID has played a part, and we know that NHS staff have been working incredibly hard under those circumstances to deal with the pandemic and to try and keep cancer services going. But we know that even prior to the pandemic, there was underinvestment in lots of key roles across every stage of the pathways, all the way from getting a diagnosis through to treatment, through to follow-up care with your cancer. Now, as we start to slowly recover from the pandemic and emerge from the other side, it's really important that government are investing the money that we need in the cancer workforce. In England, there's currently a consultation on the future of cancer care for the next 10 years. That's great, really ambitious, lots of exciting ideas in there, but that will only be possible if we've got the money to pay for the doctors and nurses that we'll need both now and in the years to come. So funding is definitely a key part of this. We know that the NHS has had its budget allocated for the next couple of years. We really want to see an adequate allocation of that given to workforce needs. And this is really about making sure that we're recruiting people into the profession, that we're creating those roles, but also making sure that we're developing careers so that cancer nursing, for instance, is a place that people want to stay and develop their careers. We're not losing people because they're seeing any progression. So it's really about getting people into the profession and developing them thereafter. So if anybody listening who is worried about their health, anybody who has suspected cancer symptoms, your GP is still there for you. So please do come forward and get yourself checked out. If you do have suspected cancer, you should be prioritized in terms of getting an appointment. And for anybody who's struggling, let's say, with getting any follow-up care or treatment, again, keep persisting. And Macmillan is here if people need any information or advice from anything in terms of cancer symptoms or treatment.